Hi everyone, Dr. Emmy from Walkaway Back Pain. Today, part 2 of our 3-part series on stair climbing to help with back pain. We're going to be talking about hip hiking and torso lateral or sideways motion while you climb stairs to reduce lower back stress and pain. Hope you enjoy. So continuing our theme of using walking, and in this case stair climbing, as a rehabilitative tool to help correct body mechanics that aggravate lower back stress and pain, today we're going to be talking about a condition known as hip hiking. In part 1 of the series we discussed the buttock weakness, which was last week's lesson, and learned how to utilize the buttock more correctly and decrease lower back stress with climbing stairs and modifying our way of stepping up stairs. Today we're going to be talking about avoiding the common tendency of hip hiking, which is the tendency to elevate the hip on one side more than another and lean the rib cage into that side, which compresses the lower back on one side and stretches on another. Many of my patients and my online clients that I help with back pain by changing their mechanics have a tendency to hip hike. Sacroiliac joint problems, facet joint syndromes, disc herniations, bulges and degeneration, stenosis, spondylolisthesis, scoliosis, retrolisthesis. Many of these patients and online clients that I help have a tendency to hip hike more on one side than another. You can usually see this in someone as they walk, because as they walk, as they take a step, you'll notice that the hip has a tendency to move sideways a little more than the other, and the hip move up. And sometimes you'll actually visually see the rib cage leaning in. This is a pattern that results from poor posture over many years. Many patients have a tendency to lean in more to one side than another. When they sit, when they watch TV, when they drive, when they sleep, their torsos are inclined to one side. Many people have a tendency to walk and stand with one leg angled out more than another. As the foot angles out, it has a tendency to drive the hip up. After years of these abnormal and asymmetrical movement and posture habits, we have a tendency to tighten the muscles on the abdominal and back regions more on one side than another and perpetuate hip hiking. So we're going to use stair stepping today as a great way as we go through our days, and most of us encounter stairs anyway, as a rehabilitative tool. As opposed to just walking upstairs without thinking, we're going to put a little thought now into how we walk up the stairs to correct hip hiking stress on the lower back. Here's how we're going to do it. As we place a foot on the step, we're going to produce a little bit of downwards pressure with the hip. You're going to swing your front hip downwards just a little bit. That's going to be associated with lifting the rib cage, the bottom of the rib cage, upwards. So you're lengthening your waist on that side where the leg is about to accept the weight of the stair step. If you don't do this, what you'll see the mistake is the hip will come up, the rib will come in, and we'll walk up the stairs with a compressive force on that side of the back. It helps to keep the foot straight ahead. If you have a tendency to angle it out, that's going to perpetuate hip hiking. So make sure the foot is facing straight ahead into the stair. As we swing the hip down, raise the rib up, we're going to keep it tall as we push that hip downwards as the knee straightens. Many people think that climbing upstairs is about raising a hip up to throw the energy into moving up the stairs. But in reality, if you keep the hip down, it allows both the buttock and the quadricep, the thigh muscle, to do its job in extending the hip and the knee so we come up that stair step. It also helps to take a mental note on keeping the hip checked inwards as opposed to outwards. Hip hiking is not only shifting upwards with the hip, but is usually associated with a sideways or lateral translation mistake. That again stresses many of these back soft tissues. So besides keeping the hip swinging down, we want to keep the hip slightly inwards towards the other side as we come up. This narrow-based hip movement will help to reduce the stress that causes many back pains, as I said, of various diagnostic entities. If you like this video on hip hiking and stair climbing, feel free to subscribe to our channel. We've got a lot of great videos out there to help you. If you would like to help me share this valuable information with others, thumbs up below, and questions or comments, as always, write in. I'll do my best to answer them. Again, if you're looking for a great program to analyze your body mechanics, figure out what your mechanical issues are, what your spinal stability faults are, what your muscle asymmetries and weaknesses and conditioning errors are that's driving the stresses that produce your lower back pain, check out our Walkaway Back Pain program available at painfreeandfit.com. It has a full body analysis that you can do on yourself, and it teaches you how to implement corrective walking techniques and exercises to help change your mechanics, condition your lower back, and get over chronic lower back stress and the resultant pain. I hope you enjoyed this video on hip hiking and stair climbing for chronic lower back pain.